Okay, I think we will get started. So, good morning and hello. Thank you again for joining us for this session, Breaking Silos, Benefits of Integrating Health, Well-Being, and Safety Solutions. I'm Peggy Neal, and I'm the Vice President of National Accounts Health Solutions at HealthPartners. So it's great to be able to welcome you here today. Traditionally, silos have separated the people who manage employee health from those who manage workplace safety. Now, however, there's increasing data to show that integrating the way you handle challenges like these can benefit both your employees and your budget. So please join me in welcoming Ginger Kakacek, Kevin Ronneberg, Paul Anderson, and David Gesko, who will talk more about the value of total worker health.
Thanks, Peggy.
Yes.
Can everyone hear me? Yep. Welcome everybody. So I just wanted to start off a little bit and kind of bring to the forefront, there's a little event coming to Minneapolis that many of you are probably familiar with this weekend. Anybody know what's coming? What's coming? Super Bowl. He's paying attention. Final Four. So in that spirit, today we have the top 3 experts in integration here to talk about HealthPartners and integration and how that can affect your organization. So we welcome them. As Peggy stated earlier, traditionally organizational silos have separated the people who manage employee health and those who manage workplace safety. This fragmented approach to managing comprehensive health and well-being may be a negative experience and also affect your budget. At HealthPartners, we're looking at how to integrate medical and pharmacy, as you heard a little bit earlier, dental and vision, disability and safety. We're finding that integration not only offers a very positive experience for your employees, but also for your budget. Today we have 3 experts here to talk about their experience with integration and what that can mean to you. Dr. Paul Anderson, Medical Director for Occupational Health and Worksite Health Clinics, Kevin Ronneberg, VP for Strategic Health Initiatives, and Dr. David Gesko, Leader for Dental Health Plan as well as Care Delivery. So I think a good way to start off today is just by level setting. What is integration? What kind of trends are we seeing? Kevin, would you tip us off with that?
Absolutely, I'd be happy to. There we go. And so I work with a lot of people in the room here. I get a chance to go out with our sales team and our account management team and work with a number of our employer groups and be able to share what it is we're doing on your behalf, the results that you're seeing, and what opportunities you might have to make improvements in the experience of your membership. And I apologize, I feel like there's some of you I got to peek under to see, but so I really have enjoyed a lot of the conversations that we've had, and I think what's really interesting is you've seen through the first couple of sessions is HealthPartners' view on integration and the role that that plays. You know, ultimately we were founded as an integrated organization with prepaid medical 60 plus years ago. We see a lot of value in having, whether it be pharmacy, whether it be medical and behavioral health, other types of services and programs operating under the same umbrella and on the same platforms. You'll hear us talk frequently about secret sauce, culture. Ultimately, a lot of the results that we get come from being aligned with the same mission, vision, values that you hear us talk about that are so important to us, and we think that they're also important to many of you in the room as well, as you see that your workforce is what is a strategic advantage for you, not only their health, but their productivity. I get an opportunity to be out in Washington, D.C. for a number of different things. One of those is with the National Business Group on Health. And the reason I bring that up is I find that it's really important to hear what some of these large national employers are talking about, because they have resources internally when they're managing their own plans, and they're looking for how it is that they can better manage their population. And we've seen a lot of cycles of people going out to market and saying, we're going to go find individual pieces and bring those together and finding best in class in each one of these narrow niche solutions. And what I've been seeing them talking about a lot more lately, much like you've seen the consolidation in pharmacy with PBMs, is how do they start to consolidate as much as possible around one platform, where that platform, oftentimes it's either an health advocacy or an engagement platform, can start to bring together the solutions that they have in place for their employees and their membership. And that stretches beyond the traditional medical. It stretches beyond the behavioral health and mental health conversations that we've had, and it begins extending into other benefits such as leave administration and disability. And so I think it's going to be important to hear what Paul has to say as well about getting further into the safety in occupational medicine, the workforce as well. We feel really strong about the way that we've integrated. You're going to hear this afternoon around the engagement platform, the personalization platform, and the way that that can take the existing systems that we have in place, the individuals that are doing the work, who know individuals doing work in other areas and can provide seamless transitions, and present that in a new and hopefully more effective way for your populations. So just a real high-level overview there if we're seeing those trends shift towards more consolidation and interest in having that one source that's bringing together these newer solutions in the market.
And Paul, David, I want to give you the opportunity to add any additional to that if you would like.
Sure, I can talk a little bit about how does this actually show up, and maybe I can share an anecdote. In my role at HealthPartners, I do a little bit of a consulting for a large local employer who will remain unnamed, and I, being in occupational medicine and environmental medicine, and also doing well at work, I function more on the safety side of an organization. So in this particular case, I was overseeing some certifying examinations. In any case, I asked if it would be possible to see or meet some of the people who also touched health in this particular company. And I asked if there could be a meeting of these folks, and the answer was yes, and we all sat down. There were 13 people in the room. Some of them, understandably, worked with each other occasionally on different topics, but each of them had their own particular seat, their own particular work that they did. But the thing that was shocking to me is that many of them had never met each other. They didn't know what each other did. Some of them didn't know what I did. And this was only, if you can imagine, half of the people who likely, and perhaps even the smaller half of the people in the organization that were thinking about health, because there wasn't anyone from the HR sort of side of the organization. And so that was a really potent experience for me, anecdotally, about siloing and what was happening. And so one of the things, if you think about how this might show up, it's just basically how do you bring that together? And one of the enjoyable parts of my work is working with Nico Pronk, and I don't know if you're familiar with Nico's work, but the basic gist that I've gleaned from it is, and you'll hear more about this later, is that just finding a place where everybody can sit down in the organization who's actually touching health in some way can be a very powerful moment for people. So it might look like a well-being committee comprised of individuals generally from HR and safety as we sort of think about these things. So that's one of the ways that this might show up, and I encourage you to kind of think about, I would imagine many people here today are from more of the HR side of your organization, but maybe not, depending on size. And I think that's one of the ways in which this might actually show up in real time is a meeting of folks that maybe have never met each other and what that might produce. So that's my initial sort of anecdote about how this might go.
And could you just clarify for some that may not be familiar what you are referring to by certifying exams?
Oh, sure. So the DOT exams is the thing I was working on, and also many organizations have people who need to wear respirators, and so they have occupational medicine physicians sort of clear people for this work. So that's what I meant, yeah.
Good morning, and I'm David Gesko, a practicing dentist in Minnesota, and also have the good nature to be able to lead our dental delivery system and our dental health plan as well. So it's a pleasure being here with you and talking about this, and I love the fact that silos is in the title. We're in the Midwest, right? So we think there's only one place for silos, and that's on farms, storing grain. Not in healthcare. Silos are a bad thing because silos mean that it's the reverse side of the coin from an integrated model. And you heard this morning from various speakers many themes about integration in HealthPartners. And so this is a new wrinkle on that. Some of you are wondering why would they have a dentist as a part of this panel. We've coined the phrase that the mouth is indeed connected to the rest of the body. You heard it here first. And so because of that, and in our very DNA and nature at HealthPartners, we practice in that way. Andrea mentioned this morning, one of the three things that people really want to know is that they want to be known when they come in. Well, in an integrated system and integrating dental into overall health, we're able to do that. We're really able to, even with our common record system, we're able to understand a person's complete health so that we can treat them better. And against the backdrop of the triple aim, which was also referenced this morning, we think an integrated model helps us, and the numbers bear this out, helps us deliver on those triple aim results. So integrating oral and overall health is a really growing part of research, and research is finding that the mouth is actually a window to the rest of the body on many chronic diseases. And so diabetes being one, cardiovascular disease as well. But being able to manage one's oral health really helps one's overall health, and therefore this integrated model, we're really leveraging it to the advantage of the patient. Thanks, Ginger.
Thanks, Al. I feel I need to step out and floss. I don't know about you guys. So kind of building upon that, what are some business advantages to integration that you guys see?
Well, I can chime in. I think some of the work that we do with integration around the health and care engagement solutions, as an example, is work that is predominantly it's behind the scenes for an organization that we work with. Sometimes there's, well, I should say more often than not, that's work that we can take away from your organization so that we do the heavy lifting and the work to make sure there's integration. And we think about things like mental health comes up as one of the areas of focus for a number of employer groups on spend each year, and looking at what solutions are available and how is it we can address that. And you're met with an opportunity in a lot of cases to talk about, well, what else is out there? Are there other things we can be adding? And certainly within our behavioral health solutions where we integrate that, there's value brought in that. One example, we think about cardiovascular disease, another top line item, and about 20% of those with cardiovascular disease also have depression. And that opportunity for us to have the same team looking at these individuals and their risk profiles, and when we're engaging them, being able to do warm handoffs to the more appropriate site. So if they're in a cardiovascular disease management program and we find that they have depression and that's something that is a priority for them, we're able to hand that off seamlessly. And there's not work required on the part of the employer if you're managing multiple vendors for different components of this. I think also as you extend that further, you think about something like an EAP. And if you can integrate EAP services into that and make that part of the same system, part of the same data, documentation systems, there again, some of that workload can be removed from an employer. With that workload comes cost. And we also think that you can drive better experiences and more affordability when you do those things.
When I think about business results, Ginger, I think about it in terms of the triple aim. And we mentioned that, I mentioned it a moment ago, and it was certainly discussed this morning. But the business of healthcare is really all about great experience, great health outcomes, and a lower cost. And in terms of my perspective here, integrating oral health into overall health can do all three of those things very well. When managing one's oral health, as I said earlier, you really improve your ability to manage your diabetes. And when you manage your diabetes well, you have fewer hospitalizations and costs go down, and health results go way up, and patients' experience goes way up. And so it's more than the clever jokes that I will throw around. It's really meaningful in terms of being able to manage overall health.
I think in the picture that I kind of threw out there in terms of having a group of people that actually got together and across the organization. I think one of the things is if there were fewer touch points for an employee that came out of that, where if they had an illness or an injury, they had fewer clicks or engagements or things that they had to do in order to get their care done, that's going to go a long ways if it's towards their satisfaction as an employee, and that's a business advantage. They like being at your organization because it's simpler for them to interact with whatever health interface they have to do in order to get those needs met. I think that's one of the main things. And I think the experience that a person has in your organization is not just them. They're going to multiply that. We all know that. And so I think that then starts having a ripple effect. And then I think as people maybe on this imaginary committee sort of get together and start thinking about or talking to each other, maybe for the first time, I think you're going to have likely the emergence of what we might call some low-hanging fruit. Some things that nobody was paying attention to, nobody thought was happening. I didn't know you did that. I didn't know we were paying for this. Oh yeah, we do that all the time. And I think those conversations would most likely happen, revealing some very easy fixes, things you should absolutely do and are not hard to do. And so those are a couple of things I think maybe are ringing some bells with some folks. I see a few heads nodding that low-hanging fruit can be an undiscovered real treasure for sort of driving down the total cost of care. So satisfaction and cost reduction, I think, are some things you probably would see as you make some strides in this direction.
That does seem like a theme of integrating all different areas as associated with health, plan, care delivery, et cetera, similar to an advantage that was touted for the EMR several years ago to eliminate duplication of services, have everything isolated in one specific area. I also want to mention that we would like to field any questions from the audience. If anyone has anything, we do have a mic runner, or you can just shout it out and we'll take it from there. If anybody has anything, please let us know.
So Ginger, I think it's also important, maybe if we're waiting for anything there, the simple and affordable in that simplicity. One of the more common things that I hear when I'm talking to employers is the workload and the complexity that gets added by adding one more phone number, one more place for their employees to go or to look for something. And so it ties into another comment that was made earlier, which is trust. And for most individuals who have some concern around their health care, we know that trust is front and center. And so the ability to be able to engage through a similar process or calling a familiar number and knowing that they can trust that individual and that individual is going to be able to connect them to the right service. Knowing there's different levels of integration. Sometimes it's awareness of what services are available and connecting them. Other times it's warm handoffs. Other times it's being able to I go back to my days at Target where we'd say surprise and delight, which is not always good in healthcare. But to really go that extra mile and help somebody, the examples of our member services reps, when you call in because of the integration, we'll have indications on whether or not we've been trying to reach you for a particular service or if you are overdue for a screening procedure. And so the value that brings, and it's not because we have a screening program, right? It's because of the integration in that data and how that data can show up in all areas that an individual might engage with an organization.
Do each of you have any specific area that you see as a particular opportunity or a challenge?
Absolutely. I think maybe I'll talk about an opportunity. Can I just maybe see a show of hands about maybe folks that work in the work comp world or safety world in some way or another in your job? Okay. So those of you who are here may know that if an employee is in the state of Minnesota, if an employee is out of work for 3 days or more, the cost of that claim actually stands as it is. But if that employee is returned to work, for example, without restrictions, or with restrictions within the 3-day period, that gets discounted by an organization called the MWCIA, and I see some heads nodding, so there's some familiar faces. So that's a significant discounting, and if you're a fully insured group or company, that's going to lead to a significant reduction in your experience mod. And what I'm proposing here is that may be unknown information to some of you or some people in your organization, and the folks in your group who are handling that may not know that. And that's one of those low-hanging fruit opportunities that I'm talking about, where if you start talking with groups and say, hey, why are people being taken off work and out of work? Why aren't we using an OCMED provider or another provider who's getting our employees back to work and gaining back what we're maybe getting dinged on the work comp side? That may be invisible, and that's the one sort of opportunity that I kind of wanted to highlight. And I can say more to you outside the session if you'd like to talk more about that. I think the challenges are one of the first ones is just doing it, getting people to talk to each other, finding the forum in an organization where that might actually happen. And then I think eventually you run into some of the understandable ways in which the organization that you're in has been broken up over time, but also language is a big challenge. How do we talk about health? What's important? What's valuable? And how are we going to think about value? And I think those end up being kind of on down the line. And I'm drawing this from some experience with a pilot that Dr. Pronk is leading with the Harvard School of Public Health. And it's a Total Worker Health Initiative. And what we're proposing is that we go into companies and we actually help them put together one of these committees. Has to be kind of coming from the C-suite. It has to be prioritized from there. This committee needs to come together, and one of us, I'm going to be one of the technical delegates that's going to go out. It's going to start to try to have this conversation with people. And even as we're trying to talk about it ourselves across our organization, we're realizing language is a big problem. It's a big challenge. So I think these are some of the challenges people might face, but I think generally the organizations that have done this find that it's very valuable in the end. So,
Thanks, Paul.
In terms of opportunities, excuse me, it's a great opportunity today even just to be able to educate all of you, and I thank you for coming and for being open to this discussion about what it is that is involved in integration. As I see trends across the country, clearly the trends are towards greater integration. If you're a standalone health plan, you're looking to partner with a delivery system. If you're a delivery system, you're looking to partner with a health plan. So the things that we've been doing for decades is now the popular trend, and integration is key in that. And we've done it for a long, long time, and have really taken it to the next level in terms of integrating oral health in that as well. And so those are the opportunities and challenges, and just to greater understand the impact on costs and on simplicity. And again, that triple aim comes through loud and clear.
Anything to add, Kev?
I'm just thinking of examples, and as you're talking to colleagues or you're talking to your organization, I think that there's, as Paul is saying, there's some real examples, and it's probably helpful for organizations to think of like real examples of where you're using the same checkbook, I'll say, to pay for claims that are related to work comp, but it's still the same belly button as the person who has medical claims, right? And so we think about orthopedics, which is roughly 16% of spend on average on the medical side. I don't have visibility on the work comp side of the amount of dollars that gets spent on musculoskeletal. Having been a sports medicine physician, I made a living off of taking care of a lot of these people, so I know it's not insignificant. And there's a fine line between who's going to pay that bill within a company, because it could be an existing medical problem that's exacerbated by what they're doing at work. And so there's an example there of if it kind of flows through the work comp side and all you're focused on is the medical claims and the medical side, you're not understanding the total impact to your organization, because you might have different people looking at days away from work because it's tied to work comp versus days away from work because it's being paid through a medical claim. And I think there's a lot of opportunity as like a real example of if you're going to take on something like musculoskeletal and trying to improve your experience, you need to understand your total experience as opposed to just the medical claims.
And building off that, what Kevin had just mentioned, very similar to pharmacy. Pharmacy is becoming so complex in how things are paid benefit-wise, medical versus pharmacy. And driving integration to account for both of those is much more effective than each one individually, because if they're not integrated, they don't talk. You would think it would happen at a pharmacy level, at a provider level, but it doesn't always. You really need it back at a higher level in order to execute that. So then I'd like to open it. Do any of you have any specific examples that you'd like to share of success that you've seen with execution of integration?
Yeah, you know, I've shared the idea of diabetes, but I'd like to even go to even lower hanging fruit than that. And in our system, we take blood pressures on all of our patients when they're new and on their recall visits. And you'd be amazed at, and in that process, we pick up a lot of folks who don't know they're hypertensive. And we're able then to make a really nice warm referral to the medical side and allow them to be treated. And many times they've come back and thanked us for being able to diagnose through their medical care things that they didn't know that were going on that came up from that high blood pressure reading. So that's an example of our integration that really touches a lot of lives and it really helps people and saves people. And you wouldn't think about that in the context of dental, I'm thinking.
And even at a higher level, the integration on that level is being able to see the continuity between the medical and dental with the longitudinal interactions there.
Absolutely. We're able to make sure folks have had their preventive services, not only in dentistry, but in the broader medicine. And those are the kind of things that your employees will really appreciate, being able to have that seamless transitions between one care and another care.
And Paul?
Yeah, we had talked a little earlier about, even just the roles that we each have are integrated. And in my role, we have the medical group and the health plan, and I kind of straddle both. I participate in care delivery a couple days a week. I do occupational medicine clinic, but I also oversee our well-at-work clinics. And one of the questions that comes up is if an employer, and maybe I'm speaking a little out of turn though, well-at-work clinics are basically when we take a version of a primary care clinic and sort of place it at an employer's facility. And so it's usually not a full-scale primary clinic, although it can be. And the question comes up, well now, what if a person has a work injury and they go to your clinic? What happens then? And because of my role, we were able to put together an approach where that person actually, we decided, just needs to have a couple of visits. Maybe that injury could be managed completely by that primary care provider who's there, usually a mid-level provider. But in certain cases, they actually need to come to see us in occupational medicine. So those are opportunities where that case may have gotten sort of complicated more than it should be, and because we're sort of looking at the whole picture in that case, you can sort of gain some benefit there. So I think that's a pretty good example in my life and experience. So.
I'll share one example I'm excited about. I won't share with you, but I'm seeing Joel Spoonheim standing in the corner that he's going to be talking about. So I'm excited for his session about the discussion he's going to lead on integration. But I think there's a few other examples that show up. And You know, I was just out in Washington, D.C. on Friday and was talking to the Office of Personnel Management, which manages the benefits for all federal employees. So, you know, we all think we have complicated jobs. I'm just starting to learn about what it is they're trying to tackle. But we as an organization that provides coverage for a small portion of the federal population, we're driving really good quality results. And they called, and the first question, because we were talking about high blood pressure management results, was, tell us about your high blood pressure management program. And we kind of stopped and looked at each other and said, well, we don't have a high blood pressure management program. What we have is we have an integrated system of care where there's quality measures that are important, and it's embedded across all that we do. I see that, you know, we have individuals that provide health coaching, those that provide disease management services. We've got, you know, and they're always asking about blood pressure because that's one of the things that's important for us. Dr. Gesko mentioned that in our dental clinics, we're measuring it because it's a point of contact and it's something that's important for us to be able to understand and glean. We also have opportunities through touch points digitally, and I'll shift or pivot just a little bit. But for example, if we've had a hard time reaching someone, one of the pilots that we've done recently is a soft alert. Have any of you ever been shopping and something slides onto your screen that is just conspicuously relevant to you based on something else that you've done? We borrowed that concept knowing that we have roughly 65 to 70% of the membership that have web and mobile accounts. And so if we have not been able to reach them for a program or an engagement that we think would be relevant for them, and they happen to come onto the website searching for benefits or where to seek care, which, you know, these occur at a little higher rate if they have risk and they're in a care episode. We just have a soft alert that says, hey, you know, we've been trying to reach you, right? I don't remember the exact language off the top of my head. Would you like to speak to a nurse? And I'm going to try and remember the numbers, and we've got some of our sales team that might correct me if I'm off a little, and I hope you will if I'm off. But I seem to recall that it was something like a 7% click-through rate on these, which is actually, you know, pretty good if you work in the mobile space. What's even more interesting is that 44% of the individuals that clicked through provided us a different number than what we had on file through the eligibility files that were shared with us, giving us a new opportunity to connect with them in a way that they're expecting us to connect with them. And so that's another example of how the integrated approach comes to bear on the website, the member services component, having behavioral health and disease management programs where we're trying to reach people. But if we're operating on that same platform across all of these solutions, it affords us the opportunity to do unique things like this and to get better engagement and deeper relationships with your population.
Actually thought of a couple other opportunities and specific examples. One would be the relationship that we have of integrated care allows us to better address significant issues like the opioid crisis. You might be surprised, but dentists are the highest prescribers of opioids in the age group adolescents into early adults. And who would know the reason why? Excellent, good. You're a smart crowd. You came up with a wisdom answer, wisdom teeth. And so because of our integrated nature, we're able to really partner across the continuum and really address that opioid crisis. And we've been able to do so successfully and dramatically and significantly reduce the number of opioid prescriptions and the count of pills. And so that's going to really deliver better results. And research has come up with solutions that will really help address that so that the patients are even more better managed in terms of their pain control. Dr. Hockey is going to do a breakout session next, I believe, and so you'll all want to stay, and he'll expand on that greatly. Another area of specific examples is a pharmacy example. Many times the folks are taking chronic medications for chronic diseases that have an oral impact. They dry the mouth out. And when your mouth is dried out, your probability of getting cavities significantly increases. So in an integrated system, it allows you to see those medications that cause this problem and address it proactively through a preventive approach. And so having that common electronic health record where we're scanning all of the medications a patient is seeing allows us to have those conversations. And when I ask my patients if they ever experience dry mouth, many times I get incredible responses like, well, duh, and what's causing that? They're not aware of the fact that the medications they're taking are actually causing that. And so we have therapies that then we can get them on that mitigate the concern for that. So another great, I think, specific example why integration really pays off and delivers the results that we're looking for.
And I just want to give anyone an opportunity to ask any questions or insights or anything that they've been wondering. Yeah.
In regard to privacy and security on
So the
patient information?
So the question was, do we get any pushback for privacy, et cetera, with the integration of all the different areas?
Security of the information electronically.
And security and electronic.
I mean, people are just really afraid of that.
Absolutely, absolutely.
Yeah, so I'll take a stab at responding to that. I mean, obviously, information privacy, data privacy is of utmost importance. So, everything we're doing as a care provider and a care financing organization really focuses on that. And to your question about member experience and member relationship, I would say one of the things that I think we've had an advantage in that space, because it does happen, is that having the HealthPartners brand and having a single brand behind it makes a difference. And so as you start to think about pulling together multiple disparate vendors that are trying to contact or reach a particular individual, they may not always know that that's part of their benefit set. If it's HealthPartners calling, there's already a level of trust that we are their health plan provider, perhaps we're their care delivery provider even. And the opportunity for us to have that data all within the same system also, I think, helps. I'm not an IT or a tech guy, but I'm assuming that there's probably less difficulty with having that data existing in the system as opposed to trying to import and export the data. So I don't see that we've run into a whole lot of problems where there's integration. I think we run into more problems where it's a third party that doesn't have a HealthPartners name, and that probably applies to any plan that's integrating outside organizations that are providing services.
I'll comment as well. Excellent question. And it was referenced this morning that, again, one of the three things that people really value is to be known. And so not only just to be known by name, but to be known in terms of their overall health. And so I find the patients that I interact with really appreciate the fact that I know the conditions that they're dealing with and the medications that they're taking. And I'll use a specific example. When I can address a patient prior to doing a surgical procedure, and I know that they're taking a blood thinner medication, and I know from looking at the chart exactly what their bleeding time is, which is a measure that we use, they feel really pleased that their complete health is being looked at. In a lot of dental practices, that's an unknown. And it's also becomes a really patient dissatisfier, delaying treatment and having to try to communicate between these silos and get that information so that you can treat patients safely. But I do appreciate your question on the level of sometimes people don't appreciate having certain knowledge of other parts. And I guess I would say in our healthcare system, all of us as professionals are very much aware of the HIPAA privacy and and regulations, and we all abide by that very carefully, and that it's critical to know a person's overall health. Thank you for the question.
Are there any others? Yeah.
I'm just curious, looking for a little clarification, Thank you. I actually am in charge of company safety, implementing policies and procedures, as well as the finances and the workers' comp, so I see all of it. Are you saying that, like, if I have an injury on the job, that I'm going to, like, maybe pre-qualify the employee to visit the HealthPartners facility because that's where their insurance is through? Because basically what happens is, like, we had a pretty severe injury last year. I do my first report of injury, but then all my communication is coming from my insurance company who's providing the workers' comp. I'm not seeing any bills. Like, I have no idea who's treating the employee really. So is that basically what you're saying, to maybe have a policy or a procedure in place that if you are injured, to follow the certain criteria and stay within the HealthPartners groups?
Thank you for that question. I think that's kind of aimed at me, so I'll take that one.
We're all looking at you.
Okay, well, so is everyone else. So in this, let me just kind of give a little context. Sorry for the injury. That's not a fun day on the job, and not a fun day for anyone who works with the person. So that's a huge event in the life of a working community. And I think the thing to remember is, in the state of Minnesota, employees can choose wherever they would like to go for their care. In the state of California, I don't know if you're aware of this, but the employer has 30 days to direct care. In the state of Minnesota, if you have an agreement with a certain number of organizations who manage work comp injury, you actually do get that privilege. And the state of Minnesota has certified some care providers who can do case management for you. So you would see all of that information. You would be able to encourage the employee. They don't have to go to HealthPartners, but they could go to an occupational health group that you trust. And you have that ability as an employer to do that. So the bigger picture that I think you're knocking at is hey, who really knows about this? You, even working in safety, don't even know where this person is going. And even to discover that and to have that conversation at large in the organization, when you think about how long it took for that person to return to work, and I don't need to get into the details of the case with you, but it may have been longer without your knowledge or without somebody paying attention to how this is going. Oftentimes it's the insurer who will say this case has gone on too long, and we need to have a case manager assigned, and many of them do provide that. But oftentimes you don't know about it, and it's not something that you have a lot of control of as an employer. And so I think if you were to have a group of people sitting together thinking about this particular event, some of these things may come up, and it may reveal that we need to maybe revise how we do this. And I think that's an opportunity there for you. So does that answer your question? Okay, yeah.
Are there any others? So just to kind of summarize and bring it all back, anybody used to drink Coke years ago, Coke Classic? Does anybody remember New Coke? So there's a lot of headlines coming out now with new integration, new mergers, new takeovers. Sometimes the classic is best because it works. It's been there a long time and it works. Now data is supporting that, so we're happy to be here for you.
And from the dental standpoint now, don't drink too much of that. All right?
He'll be handing out floss.
I know. I was going to say, when you leave, there's going to be a basket of floss outside, right, David? Yes.
Otherwise, great example. Really, just super example. Diet Coke is okay, George. Yeah.
Well, thank you, Ginger, David, Paul, and Kevin, very much. And as Dr. Gesko mentioned, if you'd like to stay for the pain and opioid session with Dr. Brett Hockey, you can stay in this room. It's going to actually begin at 11:15. But if you'd like to learn a little more about the little-known risk factor to improve worker health with Karen Lloyd, you can move next door to rooms 4 through 6. So thank you so much for being here for this session. We appreciate it. We appreciate all of you.